Hi, my name is Iana Johnson, and I will be doing a presentation on the neuropsychological assessment. Firstly, we would have the goals of the neuropsychological assessments. So the first goal is to identify the cerebral function, which will allow for finding any dysfunction and finding the specific spot that it would be. And then also, the assessment would attempt to give an accurate estimate of a person's cognitive capacity. Then the assessment would also be able to understand a person's recovery rate and if they would be able to go to their lifestyle before they had the neuropsychological issue. The assessment then would also identify mild disturbances that another diagnostic study may not have been able to differentiate, such as finding early symptoms of a degenerative disease. Then finding unusual brain organization so that it can be used for a surgeon during surgery, like understanding how a child brain injury may affect the surgery or how a person being left-handed could also affect it. Then to corroborate an abnormal EEG would allow to find the spot of the brain that could be causing epilepsy. Then document the recovery function after a person has had brain injury is to see their progress and change anything if necessary to continue their road to recovery. And then lastly, promotes realistic outcomes is by giving the patient and family information of how the condition will change their everyday life. The first issue that shaped neuropsychological assessments was the functional brain imaging. Functional brain imaging allows for the opportunity for a psychologist to see the cerebral function to identify several different types of disorders. This is the only way to identify and understand and document head injuries. The assessment allows for the measure of qualitative and subjective compared to the cognitive function, which measures are quantified objectively. The second issue is the cognitive neuroscience. This change had a concept called cut-off scores, which showed that just because the client scored low did not mean that they necessarily had any brain damage. There were several factors such as gender, age, education, and several others that would affect the cutoff scores and what they would mean. The cognitive approach was created to better hone the assessment of the cognition of a person. There was a better understanding of the frontal lobe that was originally non-existent in the neuropsychological assessments before this. The combination of functional imaging and neuropsychological test development, however, allowed for new information, and this was the reason that finding more about the frontal lobe was possible. The last issue that shaped neuropsychological assessment was managed care. The medical imaging was faster and more accurate assessments for cerebral dysfunction. It became necessary for psychologists to develop and promote assessment procedures that focused on diagnostic matters more clearly linked to treatment choice and outcomes, identifying conditions likely to result in cost savings, are time efficient, integrate treatment planning, progress monitoring, and overcome evaluation. This required a team to be sure that the patient is properly observed and outcomes improve based off of the medical imaging and all of the information that they can get through this. So the stages of neuropsychological assessment is as follows. Firstly, we're going to start off with identifying the problem and see how severe it is as the client shows. And secondly, we're going to go through with interviews and review records to understand the client's background and to see how maybe their problems may have started or where they could have come from. Then third, based off of the previous information, the psychologist will pick between a qualitative, quantitative, and functional assessments, or maybe one of all three, to figure out exactly what the client may have based off the interviews and the records. Then the fourth one is they will be interpreting the information that they gathered through the last three stages to figure out a diagnosis for the client. Then once they have the diagnosis, they will then go to the client and talk it through with them and any family or anyone else that would need to know what is going on with the client. Then after this, they would come up with a treatment plan that would help with the neuropsychological issue that this client has and give it to them so they can start working on getting better. Then throughout the whole process of treatment, they will be evaluating how the client is doing and adjust anything necessary to better help the client reach their previous lifestyle. So the diagnostic criteria for schizophrenia for a neuropsychological disorder, there would need to be at least two symptoms that are present for at least a month: delusions, hallucinations, disorganized speech, catatonic behavior, and negative symptoms. And then there will also need to be more than one major disturbance in life that persists for more than 6 months. So this would be work, school, or at home, or any other place that would be a disturbance in life that schizophrenia could cause. Then also any other possibilities need to be ruled out, such as any other disorders, such as depression, bipolar, or having autism or anything like that, or taking any drugs or medications. So the assessment for schizophrenia, there are several out there. Some other possible ones are the Stroop test, the control or word association test, and the trail making test, Part B. But this one is used a lot, and it is called the Wisconsin card sorting test, which a participant will identify the sorting between the color, shape, number, or size that is on the cards. And then based off of how they sort it, if it is correct or incorrect, the numbers will be analyzed. The numbers of the correct and incorrect sorted cards will be analyzed so that the psychologist will know if the client has schizophrenia, how serious the schizophrenia is, and then also be able to compare it to the other tests that they also use. And then here are my references. Thank you so much for listening.